Welcome to The Explainer. I'm really thrilled you're here today because we are going to objectively unpack a topic that is deeply, deeply surrounded by gym lore, wild myths, and quite frankly, a lot of dangerous misinformation. We're going to strip all that away and look strictly at the actual physiological realities of anabolic steroids using hard clinical data.
It really all boils down to one huge question we have to ask ourselves. What actually happens when the quest for the perfect body goes dangerously wrong? Today, we're taking a step-by-step look at the real side effects of anabolic steroid use, the very specific times when these compounds are legitimately used in medicine, and crucially, how to safely stop using them once you start. Just to set the stage here, look at this stark warning straight from the U.S. Food and Drug Administration. They state, the FDA found some bodybuilding products may illegally contain steroids associated with potentially serious health risks which can be life-threatening. So right off the bat, we know this isn't just about finding a quick shortcut to looking good for the summer. This is about severe, real-world biological consequences. Okay, so here's our roadmap for today. We're going to quickly cover what are AAS, hidden steroids, organ damage risks, the reproductive reality, when to actually use them, and finally, how to stop. Let's dive right in. Starting off with Section 1, what are AAS? Let's get down to the fundamental biology. So the formal scientific term you're going to see all over the literature is anabolic androgenic steroids, or AAS for short. Basically, these are synthetic derivatives of the male sex hormone, testosterone. Now, anabolic, that refers to the stimulation of rapid muscle and bone growth, which, let's be honest, is exactly what recreational users are chasing. But then there's androgenic. That refers to the masculinizing effects, things like extreme hair growth and vocal cord thickening. And here is the absolute most crucial point. Chemists have tried for decades, literally decades, to isolate just the muscle-building aspect. But a complete separation of the anabolic and androgenic properties, it's never been achieved. It's a package deal. When you take these, you always get both. Moving right along to Section 2, hidden steroids and the associated supplement risks. You might think you've got to go buy this stuff in some sketchy, dark alley, right? Well, often that's entirely untrue. It's crazy, but many products legally sold over the counter as regular, everyday dietary supplements secretly contain potent designer steroids. We're talking about unlabeled pro-hormones or highly toxic compounds like methasterone. People take these things assuming they're just safe, natural vitamins, and that leads to completely unsupervised ingestion and accidental, rapid organ damage. Now check out this data because it brilliantly illustrates the reality of intentional use. This comes from a dedicated outpatient clinic over in the Netherlands that specifically treats AAS users. Look at the mean cycle length highlighted there. It's 10 solid weeks. And that often involves stacking a whole cocktail of different compounds at supraphysiological levels. And that brings us right into Section 3, organ damage risks, specifically focusing on systemic disruptions. Let's demystify a bit of heavy medical jargon here. You'll frequently see this term 17-alpha-alkylated steroids. Sounds incredibly complex, but basically this just means that oral steroids have been chemically modified so they can survive the liver's natural breakdown process, which makes them highly effective to just swallow in pill form, sure, but it also makes them exceptionally toxic to the liver itself. It's essentially a direct, sustained assault on your hepatic system. But wow, the damage definitely does not stop at the liver. Once these synthetic hormones hit your bloodstream, they systematically disrupt your entire body. The clinical literature firmly links AAS abuse to severe cardiovascular diseases. We're talking about left ventricular hypertrophy, which is where the heart muscle thickens abnormally, as well as severe coronary artery atherosclerosis. There are also very distinct risks of liver tumors, a rare vascular condition called Pileus hispatus, and life-threatening blood clots like pulmonary embolisms. So, to be clear, this isn't just about localized muscle growth, it is a total systemic disruption. Jumping back to that Dutch clinic data for a second, the sheer prevalence of these side effects is, frankly, astonishing. Get this, 96% of their patients experienced adverse reactions. Almost everybody. The most common, severe acne at 38%, gynecomastia, which is the enlargement of breast tissue in men, at 34%, and severe mental agitation coming in at 27%. If you take these drugs, side effects aren't just a slight possibility, they're virtually a guarantee. All right, moving to Section 4, the reproductive reality and hormonal shutdown. So there's this severe clinical condition called AS-induced hypogonadotropic hypogonadism. It's a total mouthful, I know. But simply put, when you flood your body with all this artificial testosterone, your brain senses the excess and completely shuts down its own natural hormone-releasing signals. Your body's natural factories essentially close their doors for business, entirely crashing your natural hormone production. Let's look at the actual hard evidence here. These charts are from a massive meta-analysis by Christou and colleagues. They visually prove the severe hormonal crash that happens when a user finally stops taking the drugs. Your natural testosterone levels don't just gently float back down to normal. They absolutely plummet. Why? Because your body has literally forgotten how to produce the hormone on its own. In this biological shutdown, it translates into some very harsh physical realities. For men, we're looking at testicular atrophy, severely deteriorated sperm quality that can last for months, and erectile dysfunction. For women, the androgenic effects cause masculinization that is often completely irreversible, things like clitoromegaly, severe menstrual irregularities, and a permanent deepening of the voice.
Okay, Section 5, when to use AAS, covering the actual medical indications.
Now, here's an absolutely crucial point. These drugs absolutely do have a legitimate place in medicine, but the window for using them is incredibly narrow. They are strictly intended for severe clinical conditions. We're talking about the treatment of aplastic anemia, certain bone marrow failure therapies, and extreme catabolic, or muscle-wasting states, which are usually associated with severe trauma or terminal illnesses. They are designed to save lives when the body is in extreme deficit, not to push a perfectly healthy body past its natural limits. Finally, Section 6, how to stop. Let's look at the harsh reality of quitting. Let's piece together what a grueling recovery timeline actually looks like. Remember that huge hormonal crash we just talked about? Well, the Christou study validates exactly how long the body suffers after that very last dose. It takes 13 to 24 weeks just for the brain's signaling hormones to slowly recover. Even past the 16-week mark, natural testosterone levels remain severely reduced. And it takes upwards of 30 weeks for sperm quality to even begin to improve. I mean, quitting is a full-blown biological marathon. And man, during this whole timeline, users face a completely brutal withdrawal reality. Because their hormones are completely crashed, patients frequently experience severe depression, overwhelming fatigue, and even suicidal ideation. Plus, there is an extreme loss of libido. In fact, this dependence withdrawal syndrome is so incredibly severe that it frequently requires prescription intervention from a doctor, using medications like tamoxifen or HCG therapies just to try and kickstart the body's natural systems all over again. Because this is literally a major medical process, the FDA lays out a very specific, actionable protocol for stopping. Step 1, immediately consult a healthcare professional. Step 2, do not quit rapidly without medical supervision. The withdrawal is just way too dangerous to try and navigate all alone. And Step 3, actively monitor yourself for emergency symptoms like jaundice, chest pain, or dark, discolored urine, which could be a massive red flag for failing organs. Well, we've covered a massive amount of clinical ground today, from hidden supplements to systematic organ damage, reproductive shutdown, and the really grueling reality of hormonal recovery. So I want to leave you with this one final thought to ponder. Is the temporary illusion of physical perfection really worth risking your body's permanent biological balance? Thank you so much for joining me on this explainer journey. Stay curious, stay informed, and I'll catch you on the next one.